Good morning, ladies and gentlemen. I'm delighted to be here. This is my first time in Estonia, and it was lovely to see the snow this morning. We don't get it very much in Ireland, so I must say it was a nice surprise to see it when I looked out the window this morning. I am going to give you an overall view and introduction to what we talk about when we say passive drinking, or what we tend to use the term alcohol harm to others as we look at it from a scientific point of view. What I hope to cover is not alone how we view this, but how some scientists have conceptualized what this actually means, and to look, when we're examining it, the broad areas that we need to look at. And then to give you examples, I have been involved in 3 studies, 2 in Ireland and 1 in Scotland, and then looking at what does it all mean in terms of what can we do about it and what does it mean for policy. If I'm speaking too fast, please put your hand up and I'll slow down. So, why are we talking about this area now? It's true to say it has been around for as long as people have been drinking, but we have traditionally, certainly in the research area, in the academic area, looked primarily at the harm to the drinker. And most of that has been the health harm. And WHO would be one of the leading agencies who look at this area. But that is a very narrow biomedical view of alcohol harm. And so social harm is also very important, whether it's within the home, within relationships, with the people you work, or indeed in the public domain. And there has been some resistance to looking at this from a research perspective. Traditionally, I suppose going back over a century, the issue of the temperance movement in Europe and indeed in Ireland was very strong in the 1830s up to the 1900s. And so there was a strong sense of controlling communities to ensure that problems were minimized. There was also, as came into the 1900s, there was this perspective that really what people do in their own homes is their own business. And so therefore, what happens in terms of harm, if we don't see them, then we don't talk about them or recognize them. More recently, in the last 30 years, there has been some resistance when we talk about alcohol violence, alcohol-related violence, in particular domestic violence. The feminist movement, even though I'm a feminist myself, there was a resistance to say if sometimes alcohol has been used as the excuse for violence. And of course, you have violence without alcohol. But if alcohol is involved, then the severity tends to be greater. And in health promotion, there is also discussion about if we blame the victim rather than the perpetrator. We have to find that balance. And I think now, in the last decade at least, we're saying, look, we must address this issue. And it has been led by the World Health Organization, and in their global strategy, they identified harm to others as one of the key areas that needed addressing, in that because we didn't have a lot of information, research information about it. And they have prioritized it as one of their 4 key areas for the next 10 years. And to that end, there is an international group of researchers who are examining this area. And indeed, the 3 of us speaking today are part of that group. So what do we mean when we say harm to others? If you look at this, you'll see this is a graph, a depiction of what harm to others is about. This is by Robin Room in Australia, who's been one of the leading people developing this area. In the centre you have the drinker, and around is the relationship of that drinker with all of the different people. On the left-hand side, you have what happens within the home, the family, the household, and what impact that drinking can have in that area. Or down at the bottom here, you have the interaction of the drinker with their friends. And those two, that domain or that sphere of the diagram, is a lot of it is in the private domain as opposed to the public. If you look at the far corner, you have the interaction of the drinker with the people they work with, or indeed total strangers on the street. So I don't know if any of you have been to Dublin, but there are parts of Dublin on a Saturday night where if you're going down to nightclubs, etc., that you can find a lot of rowdiness and alcohol-related disturbances on the street. It has been curtailed a bit with the recession, but we certainly had major problems about 5 or 6 years ago. So that area, so there's many dimensions to this. It's not just within the family. It reaches right across the community. So examples of what this harm might be. Some are quite minor, perhaps being kept awake at night, to more severe things like injuries, assaults, property damage, and of course the effect on others, for example, the unborn child in terms of fetal alcohol syndrome. So there's a wide scope of where that harm lies. And I think that if all of you stop and look at those, I am sure there's one of them that you yourself would remember an incident where that would actually connect with you. The most influential research work to date has been done in Australia and New Zealand. They did a dedicated surveys on harm to others, and there's more countries now beginning to do that. But it's not just the surveys, and of course traditionally surveys ask the drinker about their drinking, and we don't tend to ask the respondents about the effect of other people's drinking on them. So when these dedicated surveys, that's what it was about, only about the effect of other people's drinking on them or people they knew. The agency data is probably, I know many of you are from agencies, whether it's social services, the criminal system, the welfare system, the health system, that there are many opportunities there where alcohol-related harm presents itself, not always directly, but there are opportunities to collect data and to look at that. So what we call the two-frame approach. And in some of the research I did, in one, the first one I'll talk about, we mainly looked at the agency records, and in the other one we looked at the population survey. And the cost elements, what's really interesting is that in the Australian study, they examined the economic cost, not to the drinker, but to others besides the drinker. And what they found, that the cost was as high as it was from the drinker. So in a lot of cases, this could mean that we're underestimating the extent of alcohol problems when we look at its totality. And one of the big costs of harm to others is what we call the intangible costs. It's the cost to the quality of life, to the pain and suffering. And of course, that's very difficult to put a price on, but can really affect people's life. So taking the example from Ireland, the first study, I looked at the effect the children's exposure to risk from parental drinking. And what we looked mainly was at what sort of data do we have in Ireland, and can we look at it in a different way? A lot of the data only looks at the harm to the drinker, and is there ways that we can extrapolate more information by looking at it from a different perspective? And more importantly, my first love is really a policy advice, policy advisor, and so I'm always interested in the so what. So what can we do about it? And so I believe it's very important that we hear from the people on the front line of services to know what their experiences are. And so what we did is we conducted a number of focus groups and brought the different services together to hear what their views were and what their experiences were. So in developing the study, I looked at what I call this risk pyramid for children. And it's from a public health perspective. The very bottom of the pyramid is we look at the drinking culture that's there in the country, because that influences everybody in the population, including children. And so if there is a dominant risky drinking pattern, then the risk to children automatically increases. And as you go up the pyramid, at the very top, it's more severe, and it's also far more difficult and more traumatic. And so what I tried to do in the study was to see, could I answer some of those different layers through the study. So taking the very bottom layer, I looked at survey data that was already there. And yes, we do have a dominant hazardous drinking pattern in Ireland. Over half of the population, when they drink in a hazardous way. So that means that automatically the risk to children increases because they see it all around them. Within families, there's also over half the population of adults who have children live in homes where there is regular hazardous drinking. Now, this type of harm may be very low. It may be very low level of problems, but it's the beginning of something. And if we don't address these lower level issues, then we keep getting more people going up the chain of the problem. We looked in the region of Ireland that I did this study. I looked at the national data, but also within one region. And what we found looking at local survey information is that the communities are aware of what's going on, and verbal abuse tends to be the one that seems to be most prevalent, but also children left in unsafe situations. So this really shows that people are aware that there are things happening in the community that are not good for their children around alcohol, and yet we don't seem to address it very much. I'm sure it's, as in all countries, there is a good database in terms of child protection system. But what we found is that there's two systems. There is the child protection information, and then there is the counselling services. The alcohol counselling services tend to work with adults. The child protection service works with children. But of course, many times the children get lost in the middle. In child protection, they're trying to ensure that the parent is parenting in a productive way. In counselling, they're dealing with the adult and don't really inquire about the child. And what we found that at a national level, 1 in 7, but that is a complete underestimation because they only identify what is the main cause of the child being in the system, in the child protection system. So to overcome this, we looked within one county at the detailed narrative reports that social workers document around case histories. And what we found, and not surprisingly, that alcohol hardly ever comes on its own, that there are many other issues as well. And in the case of the data that we looked at, behavioural problems with children, domestic violence in the home, mental health problems, and parents unable to cope. So that it is a very complex situation. So it's not easy, but it is important that we try and examine it. It was most interesting. One of the reasons I did the focus groups, I had been doing some work with social workers, and I was trying to find out at what point did social workers recognise that alcohol was part of the problem within the family situation. And when did they intervene? When did they decide that alcohol was such a problem, we need to address it? And what was really interesting is that we had a whole mix of not just social workers, we had the police force, we had counsellors, we had school groups, we had parents group, we had teachers, etc., youth workers. So we had very many different perspectives. But all of them were saying the same thing, that the dominant drinking culture in Ireland was that it's okay to go and binge drink, it's quite normal. So therefore there is no way that they would then perceive that as a way or when they should intervene. And just hearing the stories of what children experience because of their parents drinking, it can have actually a very profound effect on children. It can impact on how they interact, how they go to school, whether they go to school, in terms of bullying. And yet, despite all of this, children have fantastic survival instincts and they seem to be able to cope. But it does come at a big cost. And what I discovered is, in actual fact, the point at which they intervene around alcohol is only when it becomes a crisis situation. So it's very late in the process that alcohol is really factored in to the mix of the problem, of identifying the problems within the home. So what I tried to do is to fill in those gaps as to what that meant in an Irish context. As I said, the harm, it goes way up to the system, right through the system. But if we're trying to reduce the problem right up at the very top, which is at its most severe, then we need to come down to the very bottom and to try and intervene. So that is why it's so important to look at the population approach in terms of policy on price, availability and marketing, as well as the individual one-to-one interventions to reduce the overall problems in the country. The second study, we looked at population data. We added just a few items. It wasn't a dedicated survey. We looked at it in terms of the general population in the workplace and children and families. And what we found that over 1 in 4 people reported at least one or more harm due to others drinking. So the harms that we asked, as a result of somebody else's drinking, have you experienced family problems, passenger with a drunk driver, property vandalised, you have been assaulted because of someone else's drinking, or you've had money problems. Now I'm just going to highlight a few of the findings in terms of gender and age. The first is, and I think probably no surprise, that more women report family problems than men. And what was surprising and worrying is that we know that men are more prone to experience assaults as a result of someone else's drinking, mainly because of the context of the drinking, which tends to be done in public places or in bars or nightclubs, etc. But as you can see here in the graph on the right, that young women have also are vulnerable to assaults. So it's not just a male problem. And I think this is a generational shift that we're seeing, both in terms of hazardous drinking, certainly in Ireland and in England. I'm not sure what the situation is here, and I'd be interested to hear. The other issue is that sometimes it's hard to identify who is the perpetrator of the harm and who is the victim. So if you're out with friends, sometimes you can either be the victim or you can be the perpetrator of the harm. So what we found is when we looked at these harms as experienced from others, we also asked them about their own drinking. And what you see here is that those who are regular risky drinkers are more likely to find themselves with driving in a car with somebody who's drunk as well. So, in other words, that those who risk travelling, they themselves are actually risky drinkers. So often, this also is the case actually with assaults, in that you have a group of people, somebody makes some comment, and the next thing somebody punches somebody else. Before you know it, the harm to others has occurred. And sometimes it is hard to know who, as I say, is the victim and who's the perpetrator. In the workplace, and this is real tangible economic costs, as a result of a co-worker's drinking, we asked them, was your ability to do your work negatively affected? Had you to work extra hours because of somebody else's drinking at work? And accidents or close call in terms of accidents. So again, overall, over 1 in 10 workers reported one or more harm from co-workers drinking. In relation to children, we looked at 4 measures, the exact 4 measures that Australia used, which is as a result of somebody else's drinking, a carer or a guardian or parent. Do you know, were children that you're responsible for verbally abused, left in an unsafe situation, witnessed serious violence in the home, we're talking here about domestic violence, and physically abused. And again, you see 1 in 10 recorded, and this is in the general population, so you know that's an underestimation, because in the general population there's quite a widespread of rather than concentrated problems. Another interesting way of looking at it, this is not something I did, but I thought it was a most fascinating way that you could look at this problem. What was called the anatomy of a car crash. It was a very fine journalist in the Irish Times, it's a big newspaper in Ireland, a daily newspaper, and they followed a case of a drink driving event where a driver was at a party New Year's Eve a year ago, and he something happened, and afterwards he got into his car and drove, and he killed another driver. There was just 2 cars involved. But what's really interesting about this from harm to others is that there were many people affected by it. So there was obviously the victims themselves, there were the family and peers, there was the bystanders and witnesses that experienced the whole event or how it unfolded. And it was really meticulously documented based on all the facts that occurred by discussing it with the emergency services, to the coroner's court, and how the whole thing perceived. So it was all in the public domain, but it had never been examined in this way before. But what was most striking about it is that when he looked at all of the effects, he identified 50 individuals very closely connected to the event. And so all of them were affected in one way or another. So I think it really illustrates very clearly, that harm extends way out besides around the event itself, but affects many other people. So what is the conclusion for Ireland is that this is a problem. It is something that we need to look at more closely to try and understand it better so that we can provide services to those who need support, but also how we can going about reducing it. And in particular, we want the services in terms of the counselling services and child service, we want them to work closely together. In Scotland, asked me to do a similar type of report in Scotland. Alcohol Focus Scotland is an NGO, and the whole project was partly funded by the Scottish Government, and I'd like to recognise my research team. It wasn't just myself. Now, what we looked here at is, again, we were trying to get a snapshot. It was just a set number of items that we looked at. But we did look at both an omnibus survey on the general population. Omnibus means 1,000 quota sample of the population. But also we looked at what we called a case study. And we took a big city, we took Edinburgh, and we again interviewed. In this case, we did one-to-one interviews with a whole range of agencies that we thought that might have come across this idea of harm to others. And we then looked at existing data because, again, what we found is much of the data is hidden at times, and sometimes it's hard to find the data, but it is actually there and it's worth pursuing. So what we did is we looked at 16 different harms, and I'll go through them in one moment. But the other thing we added, and this was based on the work that had been done with Robert Hume and colleagues in Australia, is that they had asked about, do you know a heavy drinker or someone who drinks a lot sometimes? And what effect that person's drinking, if it had any negative effect on you. And so that this is an important element. It's not just conceptually, it's both looking at the alcohol abuser, chronic alcohol abuser, but it's also looking at your regular binge drinker, because it says those who are heavy drinkers, who drink a lot, or who drink too much from time to time, because both sets of drinkers are actually impact harm on others. So we loosely define them in terms of how it affects the public domain. So being afraid on the street, being harassed, feeling unsafe, and in relation to passenger as a drunk driver. And then in your home, in terms of being kept awake, property damage, child neglected, family problems, problems with neighbours, etc. So what we found is that overall 1 in 2 people in the population reported 1 or more harms as a result of someone else's drinking. And those harms, again, the most mentioned one was being kept awake at night, but the next 4 are very much about in the public domain. Harassed on the street, felt unsafe, afraid, and called names or insulted. And they may not seem very serious, but if it depends on the person who's receiving them, it may actually have quite an impact in terms of their willingness to go out and socialise or being afraid to walk home on their own. The second finding was that more than 1 in 3 people reported having heavy drinkers in their lives, or someone who drinks a lot sometimes. And that of those, 1/3 reported they were negatively affected. And some was a little and some was right up to a lot. And what was really interesting is we asked them about the person who affected them negatively the most. What was their relationship with that heavy drinker? The question we wanted to find out, is it somebody mainly in the home? Is this a home issue, or is it broader than that? And the rank order of those response was that a family member not in the household, a friend, a neighbour, local village member, or a co-worker. And so what that really tells us is that the impact is not just within the family, but reaches right out across the community. And those most at risk from others drinking are those who have heavy drinkers in their lives and those under the age of 55. And what you see here is the same graph I showed you a minute ago, except the darker colour, as you can see in each of the reported harms, that is the proportion of known heavy drinkers. So you can see in each of the harms, knowing a heavy drinker means you're more likely to report that harm. So then looking at what the agencies, a whole diverse, the criminal justice welfare system, the schools, services, NGOs working with children of alcohol-dependent people. So what we were asking them actually is, from your experience on the front line, what are the stories you are hearing? What are examples you can tell us of what harm to others is like from the person telling the client telling the story? And some of the main themes that emerged is in terms of just family disharmony is the way I would describe it, but that there's a lot of tension in the home, there's a lot of unpredictability. In bad cases, it can be very chaotic, unstabling really for the whole family environment. And for children, there is basically the fear and the uncertainty, and in many cases, in actual fact, the children become the carers themselves. They are the ones that have to get themselves up to go to school in the morning and to go shop and cook for the parent. And of course, in the community, some really very sad stories about how older people were affected by one or two people who, in sharing apartment blocks, that the noise level, that it was so stressful that they actually had to leave the whole complex where they had lived for many years, but they just could not take it any longer. And also the services, like, for example, the ambulance services, the hospital services, the police services, even the social services, that they themselves actually experience a lot of abuse from their clients, particularly in the emergency room where people are brought in, they're drunk, and they're very abusive to the doctors and to the nurses and the staff there, and they themselves, ambulance personnel told us of many experiences that they have experienced as well. And not just verbal abuse, quite often it's actually physical abuse in terms of assaults. So some of the quotes that I think that just summarizes what their views were, that living with a problem drinker affects the whole family like ripples in a pond. People don't realise that their binge drinking can have a negative effect on others. The perspective is that harm is caused by dependent drinkers only. But of course it's not. It's by anybody who is drinking too much. And of course, the last quote, alcohol never or rarely comes on its own as a problem. There are many, it could be polydrug use or mental health issues or other issues that are there. And so the issue may be, presenting issue may be mental health problems, but alcohol may also be there as well. It was very challenging, and I think this is true of most countries when you look, although I know the Nordic countries are particularly good at data collection, at least from my observation of how they do it. But certainly in Scotland and in Ireland, it was very difficult to get quality information, and we need to start at that. We can't understand the problem if we don't know how extensive it is. So having good data is critically important. And it doesn't take an awful lot of effort. It's trying to just put a system in place, a framework in place, so that we can see those questions are being asked. So at least we know where they're emerging across the systems. There are many, we found, for example, in alcohol-related crime statistics, that many times alcohol and drugs are put together and we don't know what the breakdown is, and that's important in some instances. It can be drugs is more dominant, but in many cases it's alcohol. And so, like Ireland, it is a problem. It's something that they've just begun to look at. But what we found is that many of the services that we interviewed said, yes, we can hear what you're saying, but we are so busy trying to deal with the problem drinker that we really don't feel that we have the time to look at harm to the family members, etc. So we need to look at how do we best support, in terms of services, those who are experiencing harm as a result of somebody else's drinking, and to encourage people to come forward so that they can get the support rather than stigmatise it and hide it. I think there is a potential, if there were surveys, and even to ask the question about, because we know it's a really strong predictor, if you have known heavy drinkers in your life or someone who drinks a lot, then that could be an alert sign to say, okay, this is something we probably need to ask a little bit more if the answer is yes. So there's many challenges. The first and most important, I suppose, is to try and examine what is there already with a new perspective in terms of not just harm to the drinker, but harm to others and all those others that are around the drinker, and to develop a framework that actually will allow a broad, integrated set of information, whether it's from the health system, the social services system, the criminal justice system, and indeed many other sectors that are involved. For example, the whole issue in terms of schools, if we're looking at children, etc., they're critically important in terms of being the ones that can actually can be the first to actually identify where there are problems, maybe bullying at school or absenteeism or whatever, to see is there a problem in the home there that can be addressed before it becomes a very severe case up at the very top. So we need to take a proactive approach in services, but also in terms of policy. And finally, I think we need to recognise that when you add this new dimension of passive drinking or harm to others, then it really does broaden and expand and increase both the human cost and the economic cost of alcohol harm to alcohol harm in the population. I think it is actually has parallels with passive smoking, but I think the harm is much more extensive. The passive smoking is quite defined in terms of its impact. It's mainly a health impact, whereas the harm passive drinking is much more a broad social harm phenomena, and I think has much more profound long-term effects about the quality of life of both individuals and the population. And so the population approach is we need to look at the policies of price, the affordability, the availability, and of alcohol in the community in order to reduce the harmful drinking, because if we reduce the harmful drinking, then we also reduce the harm to others. Thank you very much.